on birth control with Dr. Khan. So Dr. Khan, are you ready for today?
Let's do it, I'm ready.
Question 1. What if I'm less than 48 hours late on my combined pill?
So that's a very common question. We get it all the time. So you should take the late pill now and take the next one at the usual time. So even if that's 2 in a day, and you don't really need backup, and emergency contraceptive isn't usually needed. So yeah.
Awesome. Question 2. What if I miss 2 or more combined pills, which is 48 plus hours, especially near the end of the pack?
So that's a bit more complicated. So you should take the most recent missed pill now, and then keep going daily, and then use condoms or abstain for 7 days. If you missed pills in the last active pill week, then you should skip the hormone-free days and then go straight into the new pack. And consider emergency contraceptive if you missed pills in week 1 and had sex in the last 5 days. So that's what the CDC says.
Awesome. And what if I vomit or have bad diarrhea on the pill? So what do we do?
Yeah, so very important, if you throw up or soon after a pill or have severe diarrhea, especially if it lasts 48 hours, then you need to follow the missed pill rules and then use backup. And if you had unprotected sex, then you should definitely use an emergency contraceptive.
Okay, wonderful. Question 4. What if my patch is off and I'm late on putting it back by less than 48 hours? So what do we do?
So there's no problem, just as soon as you realize that it's been a long time since you put on your patch, just slap on a new patch as soon as you notice. And then you should keep the same change day. So you shouldn't change the change day basically. So if you decided to change it maybe Thursday or whatever your routine is, just make sure that you follow that same routine.
Okay, so it's gonna be a similar question this time, which is, and if the patch is off or late by 48 hours or more, so what do we do in that case?
So in this case, the patch is late by more than 48 hours, right?
Yes.
So you should apply the patch now and then use the condoms or abstain for 7 days. If this happens in week 3, then you should skip the patch-free week and start a fresh cycle. And consider emergency contraceptive if the detachment late start was in week 1 with sex in the last 5 days.
Which is, what if a person is breastfeeding? When can they use combined pill, patch, or ring?
Okay, so combined hormone methods aren't recommended in the first 3 weeks postpartum. And then the timing obviously depends on the individual venous thromboembolism risk, ET. Basically, what happens is these hormonal drugs, they have estrogen, progesterone, and that increases your risk of having some sort of stroke or something like that, immediately after postpartum. So these are usually avoided. And so progesterone-only methods can be started immediately postpartum if you're otherwise eligible. And this again should definitely go through your physician who's taking care of you. And that's it, yeah.
Okay, and what if the person gets migraines with aura?
Oh yeah, that's a very good question, and this is one of the absolute contraindications to taking OCPs, which is oral contraceptive pills. So if a person has migraines with aura, they should definitely not be on oral contraceptive pills. They should, be off of it. Yeah, and there are definitely so many other methods of, using contraception, but OCP should not be used for that. So yeah.
Okay, and what if a person has high blood pressure?
Okay, so high blood pressure is a relative contraindication, which means that your physician is the one who's going to decide if you can use it or not. But in most cases, if you have slight hypertension, somewhere around 140 to 90, then you can, in a lot of cases, safely use OCPs, which is oral contraceptive pills. But yeah, definitely, if you have very high blood pressure, something that, or there's some underlying reason for you having that blood pressure, hypertension, then you should definitely avoid OCPs.
Okay, so what if a person's periods are heavy and crampy? Should they switch to IUDs? What do you suggest?
Okay, very good question. So IUDs, some of the IUDs do cause heavy cramping. So if you have, using copper IUDs, then yeah, they definitely do lead to, excessive bleeding, menorrhagia. So that is a thing. Basically, when women seek us for some help regarding using IUDs, what we see is that do they have heavier periods or do they not have heavier periods? If you have heavier periods, then you still want to go in an IUD, and you can definitely. Then we usually go for levonorgestrel IUDs, which basically sort of maintain the progesterone lining in your uterus, and then definitely it sort of stabilizes it and it leads to less bleeding. But in some cases, if you don't have any problem with heavier bleeding, then you can definitely use copper IUD, which is better in my opinion.
Okay, well, thank you for that. Okay, so what if I want to skip my period this month? What do I need to do?
Yeah, so as I said, then if whenever you're using oral contraceptives or any sort of hormonal contraceptives, which can be in the form of pills, patch, or rings, you can safely skip the hormone-free days. So you do not, stop taking those drugs for that specific week. You keep on taking, the whole 4 weeks in a month, and then run packs continuously. But you should expect some breakthrough bleeding because, the body is designed to shed that lining after 3 weeks, and if you don't, then it gets unstabilized and then it comes out. But before doing all of that, do talk to your physician. That is very important because all of these things are done on a day-to-day, on a patient-to-patient basis, basically.
Okay, well, that was a Chris. Dr. Khan, thank you so much for that.
No problem at all, anytime. And then remember, most methods have a simple backup window, usually 2 to 7 days. Emergency contraceptive works best ASAP, and then condoms also have this added protection of STIs. So be safe, have fun, and see you guys next time.
Thank you.
Bye-bye.
Bye-bye.